Sarabi, and I'm a medical assistant student at Westmed. And today I'm going to be showing you how to take a patient's blood pressure. So to start off, we're going to go ahead and look at the components of a sphygmomanometer, which is also called a blood pressure cuff. This here is the gauge, which tells us the systolic and the diastolic number, which we'll go more into about later. This right here is the valve, which helps tighten and release how much pressure we put into the cuff. And this is the bulb, which is what we use to put the pressure in the cuff. And this part is the part that goes on the patient's arms. So first things first, we're gonna go ahead and make sure that our patient's legs are always uncrossed. So it's gonna help us hear the carotid cough sounds better, which is when the blood flows through the arteries. So can you please uncross your legs? Thank you. And then we're gonna go ahead and we're also gonna use our stethoscope to hear these sounds. So what we're gonna do is we're gonna have it out and we're gonna make sure that we put it in our ear the right way. And a fun fact, if you're a hijabi, you might wanna have your hijab on a little loose so it's easier to access your ears. So to make sure this is on, we're gonna twist this and click. I don't hear the sound. And then we're gonna twist it again and I hear it, it's really loud. So we're gonna go ahead and ask the patient if they have a preferred arm, because their arm might have like a birth control rod or anything like that. So do you have a preferred arm? No. Okay, we're gonna go ahead and use this arm, is that okay? Mm-hmm. Okay, so we're gonna make sure that the patient is not wearing anything thick. Like for example, what the patient is wearing here, this is very thin, so we can hear those sounds very easily. But if they're wearing like a hoodie, they might want to take it off so we can access the arm better. So we're gonna go ahead and put the cuff on, and it tells us how to do it. Like here it says artery mark, and that's what we're gonna have here. We're gonna put, this is the artery, we're gonna have it right here, and then we're gonna make sure to wrap it so it's not too tight but not too loose. And then we're gonna put our stethoscope on top of the artery and hold it with 2 fingers like this to make sure we hear the sound better. To get the systolic and diastolic, the systolic is when the heart, the number when the heart contracts, and then the diastolic is when the heart relaxes, the heart muscles relax. So to read this, we're gonna see that from one big line to the other one, it's 10, and then in the middle, it goes by 2s. So for example, if it was from in between 40 to this line, it would be 42, 44, 46, 48, and so on. Now I'm going to go ahead and take her blood pressure, but before I do that, I'm going to go ahead and communicate with my patient to make sure she doesn't have a history of high or low blood pressures. Do you have a history of having high blood pressures or low blood pressure?
My blood pressure tends to be on the lower side, around 90.
Okay. So this way we can get an accurate reading and make sure we don't give a wrong diagnosis. So when I'm taking her blood pressure, I'm gonna make sure that her hand is at heart level. So if I need to, I can hold it like this under my own arm. And I'm gonna place this on the artery. And if you can't really hear the sounds, sometimes it's best to look at the red and then see where it ticks, because it helps as a guideline to tell you what the blood pressure is. So you can see it once I take her blood pressure, which is, I'm gonna go ahead and do that. You're gonna pump to 180 and then slowly release. So my patient's blood pressure was 94/50, and this makes sense because she told me she had a history of low blood pressure. And blood pressure always changes depending on certain factors such as age, if they're pregnant, if they smoke, and if they have eaten or not, and if they have been exercising, and all other aspects. So it always depends on the patient, and it's not always going to be the same. But that's basically how you take blood pressure from a patient. Thank you.